Very happy to have Dr. Brett Levinson here with us this evening. A lot of you have registered and a lot of you have asked some very good questions. And Dr. Levinson is going to give a talk and answer them. So thank you and enjoy. Remember that it is being recorded and will be available on the website by the end of the week. So thank you. Dr.
Judy,
Levinson.
thank you for inviting me to give this talk. My name is Brett Levinson. I am a cornea specialist, an eye doctor in the village of Cross Keys in Baltimore. A cornea specialist is an ophthalmologist, an eye surgeon, specializing in the problems of the front of the eye. And we deal with the various issues of Parkinson's all day. It's amazing how often we see Parkinson's now and how often the problems of Parkinsonism are left untreated or undiagnosed. So I was happy when Judy asked me to talk because we see this all the time, and the problems I think are both simple and complex. We can kind of go through the ins and the outs and the ups and the downs, and I'll kind of give my 2 cents and my spiel about what we know now, what I know, and then we receive some questions. And to be honest, the questions are kind of the nut meat of the whole thing. And I think the questions will help to elucidate a lot of what we have. In my mind, the biggest problem we have when people say to me, doctor, I have Parkinson's and my eyes do this. A lot of the problem is the slowing of the facial muscles. And when we think about Parkinson's, you often hear the term of amassed faces or just slowed down facial movements. Maybe the face doesn't move as much. And we don't think about the blink function, but the function of blinking is critical to how the eyes work. And if we slow down our face, maybe it changes our facial expressions, but we blink in an unconscious manner, and each one of these blinks are important. The blink function helps to move the oil glands of the eyelids forward. And we have about 30 oil glands, called, the medical term are the meibomian glands. We have 30 oil glands on the right upper, the right lower, the left upper, and left lower eyelid, so about 120. And over time, these glands start to lose their function. They lose the function at the outer edge and the middle edge first, because the blink function there is weakest. But when we don't blink, when the blink force is decreased, these oil glands start to die off and they don't work. You may hear the term dry eye a lot. And dry eye is kind of a misnomer, because it's not really a dry nor an eye problem. The same way, as a doctor, I wash my hands about 40 times a day. And the more I wash my dry hands, the worse they get. So amazingly enough, water won't help my dry hands. And when we have chapped lips, the more you lick chapped lips, the worse they get. So while the term is dry eye, and you would presume logically, well, more moisture, more tears that you buy over the counter would help, often tears don't do that much, because the natural oils that we lose are the problem. That's why when we have dry hands, we use lotion on our hands. Lotion repels water, and we use chapstick on our lips. So when the oil glands stop working, especially in Parkinson's, because the blink force decreases, as we decrease the facial muscles, when we lose dopamine, we lose the ability for the muscles to work properly. That creates a whole host of problems. My throat's dry too. It creates a whole host of problems. So the majority of the issues we see in Parkinson's in my office are due to the loss of meibomian glands. The medical term is meibomian gland dysfunction. We try to address these issues as much as we can. One of the easiest things we can do, especially in Parkinson's, is something called a punctal plug. You can think about the eyes the same way you think about a faucet in your sink. So you have tear production. That's the water. There's a hot and cold, you turn it on. There's also a drain where the water flows away. So the guy that designed us put two drains in our eyes, just like there are drains in our bathtub. And we can put stoppers in these drains that help to retain more of the moisture. And when we blink less in Parkinson's, the plugs help to keep that moisture in place. You know, when I see someone with Parkinson's first, I really try to address these things. It's hard to have people increase blink function. It's almost like saying to somebody, swallow more or make your heart beat faster. It's really hard to do those things consistently for over a day of life. So we as doctors need to address those things. One of the things I recommend first is something simple, which is a hot compress. And you want it as hot as possible without burning yourself. The same way, if you remember the old style barbers, put a hot towel on your face, or you get a facial, heat opens pores up. So the heat on the eyelids helps to open the pores that are not being stressed by the natural blink function. So, and you don't have anything fancy. They sell these masks. I was at Walmart the other day. They're $6.95 at Walmart, these masks. Microwave 30 seconds. You lay the heat over your closed eyes for a few minutes. You don't need much time, maybe 4 minutes. When the heat cools down, remove the mask and you open, close, squeeze the eyes. Open, close, squeeze. And that heat helps to get the oils flowing. I'm not going to choke. I'm talking all day. My throat gets dry. That's why I got the water here. Omega-3 fatty acids work great too. I'm a big believer in omega-3. You want an omega-3 that comes in a triglyceride form. Most omega-3 come in a form the body can't digest. Some people with Parkinson's have a hard time swallowing. We have a good now gummy as well. So Nordic Natural makes a gummy omega-3. Now, I don't like swallowing big pills. I did the gummy myself. They're pretty easy to swallow. You can chew them up. But the majority of omega-3 are produced by large corporations like Walmart that make a very low quality product. They smell fishy. You get a burpy aftertaste. So one good brand is called Nordic Natural. That's the one we have in the office. But you want something in a triglyceride form. You shouldn't have a burpy aftertaste with fish oil pills. That means it's not being digested. The same way, if you go to a fish store and you smell rotting fish, walk out. You don't want to smell rotting fish in a fish store. If you're taking a fish oil pill and you have that burpy taste, it's not a good product. There's some plenty of thicker lubricating drops we like. Most drops are just too watery. They don't replicate the oil. And there's actually a few new products coming on the market pretty soon that help to get the oils flowing. So we're expecting a brand new eye drop from Bausch & Lomb. It's been years in testing. That's going to help to get the oil glands flowing, which is the problem in Parkinson's. There are plenty of eye drops that help to reduce inflammation, but if you don't get the oils flowing, the oils harden up. The same way, if you have a classic car, but you haven't changed the oil in your car for 30 years, the oil just hardens up. You just can't add new oil to your classic car. You got to change the oil. And there are things we can do in the office, such as intense pulse light, where we squeeze the glands and get the oils out. So that's number 1, 2, and 3. When people say to me, I'm seeing double with Parkinson's, a lot of that double is due to dryness of the eye. It's hard to believe. When you Google Parkinson's and dry eye, you'll see a lot of things about double vision, about muscle movement. That's a much less common issue than dryness and hard to fix. We don't really have a ton of good neurological ways of fixing decreased muscle movement. You can always increase your medicine for Parkinson's, and that's up to the neurologist. That's not my field, and I have no knowledge there. When you read about Parkinson's online, you'll see a lot of things about what does dopamine do to the retina. Do we have color problems? And that's kind of egghead stuff, and that's beyond my scope of practice. It's really hard to fix when it comes to the brain. We don't have a ton of, and amazingly enough, in the year 2023, we don't fully know how the retina works. The retina is one of these complex neurological issues that we don't get. And as advanced as we are, we haven't really fully unpacked how all the layers of cells work. We don't have a way of going in and fixing these connections in the retina. It's amazing how we've evolved, and a thin layer of tissue that's hundreds of microns thick gives us a whole visual world. And the retina has that whole range of input. And when you hear people say, we only use 10% of our brain, well, that's not true. A lot of the brain is devoted to visual input. The whole back part of the brain is called the occipital cortex, about 40%. So the tiny part of tissue, the eye, and almost a third of your brain is devoted to making this visual world into what we see. And we don't really understand how it works in a large way. So there's no question that the change in dopamine changes how the retina works. But when it comes to therapeutics, I don't have that. I don't have a way of fixing that very well. But a lot of what we do is, in my practice, is helping the oil glands of the eyes work better. When it comes to Parkinson's, in my practice, it's 1, 2, and 3, meibomian gland dysfunction. It's the making the oils work better. What comes next is getting a better pair of glasses, getting the understanding how the eyes work. When it comes to glasses, the same way we would never say to ourselves, I want one pair of shoes. I want a magic pair of shoes that I can go to work in, I can dance in, I can go out for, to a fancy meeting. We understand there's more than one pair of shoes you need. And when it comes to glasses, it's the same thing. We all want one pair of glasses that does distance, computer, up close, driving your car, sunglasses. And in Parkinson's, that may not be the case. So sometimes the answer is more than one pair of glasses. A pair of glasses just for the computer, just for reading in bed, just for driving your car. We always assume that is one magic pair of glasses. But when it comes to Parkinson's, sometimes not the case. And the other tints we can do as well. So that's my basic intro. I think questions now make sense.
Okay, I can read you some of the questions that people submitted. What's this one? Oh my goodness. All right, I'm going to have trouble pronouncing this. Can you read this? Can you see?
I can't see what
It says, is FUCHS DYSTROPHY common in PD? And what's the treatment?
Yeah, so that's Fuchs dystrophy. It's named after a German guy named Fuchs. Fuchs dystrophy is a congenital genetic problem of the back part of the cornea. The cornea is the clear dome in the front of the eye. If you imagine the cornea as a dome-like structure, it helps us focus. And it's soaking in fluid like a sponge. The cornea needs to remove fluid, just like a boat. In a boat, you've got a bilge pump to remove fluid. If you don't remove fluid from your house with a sump pump or a bilge pump in your boat, eventually your house floods and the boat sinks. Fuchs is a problem that we don't know why it happens. It's genetic, but the cells that function to pump out fluid die for some unknown cause. We really have almost no therapeutics now. There's some few people who've tried this using something called a ROCK inhibitor. That's hard to get. We get it from Japan. We have great surgeries now for it, where we can remove the back part of the cornea and transplant it. It's not really linked to Parkinson's. I apologize. I've got TB. I mean, I'm getting better.
I'm glad to hear that.
I'm getting better. I mean, it's from being a doctor. I spent a few months in Calcutta. That's part of the problem. I'm not gonna lie, the beer helps. So, but Fuchs is something that I deal with a lot as a cornea specialist. I really have very little way of slowing it down. We can monitor Fuchs, but there's really it's not a Parkinson's related problem. It's unrelated at all. It's a genetic, it's in our genes, and we can't cure it, but we can treat it well with the surgery.
Okay, so another question is, since getting Parkinson's disease 14 years ago, about 6 to 8 times a year, I experience a visual aura, but I have never had a migraine. Is this related to my Parkinson's? Should I be doing anything for it? And is it likely to develop into a migraine headache?
That's a good question. So when it comes to auras, again, no one knows what caused them. So we can think of auras as on the migraine spectrum. Migraine, like dry eye, is a weird term. We think of migraines as meaning headache. We kind of relate the terms as equal, like Kleenex and tissue. They're the same thing, but obviously you can have a tissue that's not a Kleenex. So migraine in the medical world refers to a whole host of problems in the brain. You can have a migraine that any one of the 5 senses can have a migraine. You can have a smell, a weird, funny smell, a taste, a hearing, a feeling, but the most common is visual, and we don't know why. A migraine refers to some kind of increased activity in the neuroelectrical part of the brain. What the link is with Parkinson's, we don't know. There's probably a link. It's hard to test. The biggest problem with Parkinson's patients is that they're very adverse to us taking their brains out and slicing them. And that's the best way to tell. When you ask people, can I kill you and cut your brain out and slice it? They'll say no. And that's the biggest problem, which they die. So that's the problem. People are so stubborn. They don't want us to dissect their brains. They're all like, no, don't do that today. Do it like 30 years from now. So that's part of the problem. We can't, it's really hard to slice those brains open and see what's happening. So what we have now is functional MRI. That's all we have. And the hard part is the auras last 20 minutes. It's very hard to get people in that 20 minutes to the hospital in the functional MRI machine and see what's happening. When it comes to auras, we know so little because they're so transient, they're so quick that we have very little data about what's happening. We guesstimated that it's some kind of neurochemical impulse that triggers something. And we can say that the aura is a migraine. Will you have headaches with them? Maybe, maybe not. I see many people that just get a visual migraine, just an aura. The way they describe it is kind of a zigzaggy, expanding colors, like you take a rock and throw it in the water, you see the ripples. Commonly, it's almost like a fort or zigzaggy lines or squares or shapes, and it goes away. They can be very scary the first time it happens. We get one phone call a week of somebody just freaking out. They think they're dying, having a stroke. The first time is pretty scary because you're thinking, what's going on? Am I going crazy? I'm seeing these weird things. So the answer is, I don't know. It's really a benign process. I wouldn't worry about it. What can you do? Actually, caffeine helps. Sometimes a cup of coffee helps, or Excedrin migraine with caffeine in it helps. Or just laying down, close your eyes, relaxing, meditating helps. They all pass. Will it change? Will it go away? Will it evolve into a complex migraine with a headache and pain? Sometimes, not often. What's the link to Parkinson's? No one knows.
Okay, next question here. What advice do you have for getting a cataract operation if you have PD? My ophthalmologist is saying that I should have it done.
I mean, number one is go to a good surgeon. That sounds silly, but you want to go to somebody that does a lot of surgery. When it comes to cataract surgery, some people do a little, some do a lot. And you can ask around, get another opinion. I know who I treat and who I would take care of. So I stopped doing cataract surgery. I just do cornea problems. And it's hard to know when you're a patient who's good, who's not. And you can get another opinion, you can ask around. But number one is to see somebody that's doing a lot of surgery, and that's someone you want to see. Cataract surgery is beautiful in the simplicity of the complex nature. When done right, it's wonderful. And when done wrong, it's hard to fix the problems once done. So as somebody who deals with the problems of cataract surgery done wrong, it's hard to put back an egg once cracked. So, I mean, it sounds crazy, but getting it done right the first time. I'm sure whoever you're seeing is great. I'm sure you're seeing a great doctor. If you trust them, you know them, then you're in someone's hands. When you get on a plane, you have to trust the pilot is doing the right thing. They know how to travel through air. Getting on a plane is scary. I don't like flying. They make me fly to go to meetings. For some reason, people always want to hear me talk. I don't know why. I'm kind of a bore. But I've got to fly to Florida soon to lecture people. And again, I'm a real blowhard. I can yak. So I don't like flying, but it's scary. And you have to trust the pilot that they know what they're doing. But number one, I would say is, again, without being a dead horse, to make sure the dry eye is under control. Of the people who are unhappy after successful cataract surgery, going to a good surgeon and everything correct, if the dry eye is not treated beforehand, people are still unhappy. So punctal plugs, hot compresses, steroid eye drops, all those things. In Parkinson's disease, those things are all worse. If we don't address those things before surgery, they're just worse afterwards.
Okay. What type of eye healthcare specialist would you go to for refraction? An ophthalmologist, an optometrist, a commercial company like Lens Crafters? Over the years, I have gone to all three, and I'm not satisfied with my glasses. I have bifocals.
So let's go to the last part first. Many people with bifocals many people with bifocals don't really have bifocals. So a bifocal lens has a line in it. I see people all the time who say to me, I have bifocals. They don't. They have a progressive, a no-line bifocal. So I don't know what you have, but I can swear to you, I promise you, people who come to me all the time, look at my bifocals. They don't have bifocals. So I don't know what you have. That's number one. Number two is we find that optometrists do a really good job at refraction. That's what they do all day. When it comes to surgeons, we're not really well trained in refraction. We don't do a lot of it. That's not part of our training. Optometrists do it all day, every day. So they're really good at it. And when it comes to the commercial places, it's kind of hit or miss. It's a different person every time. There's no follow-up. When you're one person in an office and you see the same people day in, day out, you know what's going wrong. It's hard to learn from your mistakes if you don't see them. If you see someone one day and you give them a bad glasses script and you never see them again, you don't know what you did wrong. So we find that finding somebody that's in their own practice, in a private practice doctor, as opposed to a large chain, just like going to a small restaurant as opposed to a chain restaurant. If you go to a small restaurant, you tell the chef what you want, and they'll do what you want. If you go to TGI Fridays, you get what you get. But that being said, if you've gone to many doctors and you're still unhappy, there's probably something else going on. And the most common is dryness of the eye. So when the eye is dry, it's like trying to give a lecture with a dry throat. You have to stop every few minutes, take a sip of your beer. When the eyes are dry, the refraction shifts constantly. It's like the sands of the Sahara. Until you control the dryness, you'll never get an accurate refraction. It's different every day. So if you say, boy, I've been to 5 optometrists, I've had 10 pairs of glasses, none of them are good, the answer may not be the glasses. The answer may be you.
Okay, next one. We've got a lot of questions. Everybody really has a lot of questions to ask. I see a retina specialist. I have some dry macular degeneration and an operating ophthalmologist. Do I need to see a neuro-ophthalmologist as well? Last June, I lost sight in my left eye momentarily. I was admitted to a hospital for many tests of the brain and heart. The conclusion was a mini stroke from a clot in my eye. Brain scans were okay. Excuse me. My doctor's group doesn't have one, and insurance and cost is a concern. I'm in Pennsylvania.
Yeah, I mean, probably a neuroophthalmologist won't add much more. It's hard to know why you lost vision for a moment. I see that a lot. And again, amazingly enough, sometimes just dryness can make you perceive to have a sudden vision loss. It's really hard to prove that a small blood vessel blocked your vision. That's kind of if you go to your internists or neurologists, that's always their default backup guess. It's hard to prove that. It's really hard for us to look at the small retinal vessels and guess what's happening. We have ways of doing that called fluorescein angiography. We put a needle in the arm and watch the blood flow through the retina. And if you tell me that I lost sight for 20 minutes, 30 minutes, an hour, a day, and we see nothing, say, well, maybe you had a stroke and it's gone. That's possible. It's also could not be true. We don't know. It's hard to know what a neurologist of the eye would do for that. They would say, watch your weight, lower your cholesterol, be healthy, take your medicine. Nothing you don't know. So there's really not much more they would say. When it comes to neuroophthalmologists and Parkinson's, they don't add all that much over your neurologist is going to do, or an ophthalmologist is going to do. So I don't think you're going to get much more. And it's hard for me to know, hearing that story, you may have had a stroke, you may not have had a stroke, who knows? But I see people all the time that tell me they lost vision for 30 minutes, an hour, a day, and vision is perceptual. So it's hard to know what's happening. A migraine can do that. We have people with migraines for a day or two, which is uncommon, but at least a few hours can cause a loss of sight. And a migraine is not thought to be a stroke. So it's truly hard to know what caused that kind of symptoms.
Okay, you might have touched on this already, but what are the difficulties? So I have PD. What are the difficulties in evaluating eyes for cataract surgery and how to get around them?
Yeah, I mean, that goes into the same thing we discussed before, which is that a thorough eye exam, a careful eye exam, if you say to your doctor, my patients are always shocked. They'll say to me, well, doctor, they want to ask questions because they feel that if you don't ask questions, you're not being proactive. And so I'll say, do you have questions? They'll say, yes. And the question is, do I have cataracts? And I'll say, well, yes, you do. And they're just flummoxed. I have cataracts. I have cataracts. They're just choke. I have cataracts. It's like saying, do I have gray hair or wrinkles? Cataracts are a part of passing of time in the body. And it turns out, Judy, that every person that you went to high school with has cataracts. Cataracts are part of time in the body. And every person you know from high school has cataracts. And because you have cataracts does not mean you need cataract surgery. The same way, not everybody with atherosclerosis needs a heart bypass. Not everybody with arthritis needs a new hip. Because with arthritis does not mean we need a hip transplant. There's a whole spectrum. We don't wake up one day and you need a new hip. You don't wake up one day and you need a bypass surgery of your heart. It's a gradual process of the passing of time in the body. So while you may have a cataract, that does not mean it must be cut out. And before my team and I do cataract surgery, we believe that as surgeons, we should measure twice and cut once. Try everything else first. Make sure we've tried all the dry eye things first. The best glasses, punctal plugs, steroids, dry eye therapy, intense pulse light. If we try those things and you're still unhappy, well, then it's time. But we see people, because again, if you're 75, you've got cataracts. It's just a function of time in the body. You have gray hair, you have some wrinkles, some arthritis, some atherosclerosis. I guarantee they're there. Whether they're clinically significant, that's something else. Because you have some heart blockage does not mean you need a heart bypass. We all have some. So the question is, when is the time? And we try to delay until we have to. And that's really the art of surgery.
Okay, next. I was diagnosed the same week with Parkinson's disease and binocular vision dysfunction. Are they related?
Maybe. You know, that's who knows. It's not a thing I see very often, honestly. Not in adults, but possible. I mean, when it comes to a neurological process, it's possible. But again, very often dry eyes misdiagnosed as that. So if the eyes are dry, you kind of get a double vision. And if you don't think about it, people say, oh, it's a binocular problem because you close your eye, one's better. But if the eyes are dry, it kind of gives a double vision. So it's hard to know. And I mean, I have to examine you. I'd say it's possible, but I have no idea.
Can you explain why my eyes seem to be locked shut at night?
Yeah, I mean, so if you read the Parkinson's blogs, the theory is that maybe the muscles from dopamine decrease at nighttime. But the biggest problem is that the oil glands, again, back to dry eye. You know the kind of crush you get in the morning, the sleep you get, that's the blocked oils. And in Parkinson's disease, it gets worse. They harden up and it turns to glue. And so the hot compress at night helps that. If the oil glands don't work, as we're sleeping, the same way, if you have butter and you put butter in the fridge, it hardens up. When you have butter on the counter, it's easy to cut. If you go to your fridge and you want to butter your bagel in the morning with the schmear, the butter is hard to cut out of the fridge. The same thing happens to our eyelids at night, like butter in the fridge. They harden up and turns to glue. And so people with dry eye or meibomian gland dysfunction say, boy, Brett, I got to pry my eyes open. I got to pry them open. They're so stuck. 99 times out of 100, that's dysfunctional oil glands. We need to address the blocked oil glands with hot compresses, omega-3, and dry eye therapy.
Okay, one of my eyes is half closed, not my eye, but somebody's eye is half closed. Is that because of Parkinson's? This is on the left side, and that was the first side affected by Parkinson's.
Yeah, I don't know. That's kind of hard to answer. There are many things can cause that. So just time in the body can cause a droopy lid called ptosis. It can be neurological, it could be trauma. So I don't know. That's, you need to be examined by some. I have no idea.
Can Parkinson's disease cause eye muscle weakness that results in diplopia?
Yes. Yeah, yes. That is a known issue. It can cause, facial weakness. That's, I mean, when it comes to how nerves work, all those things are yes. The problem is we don't have a great cure for that. We have medicine for Parkinson's, but again, that's why I try to fix the dry eye first. When it comes to if it's muscle weakness, in the year 2023, our therapies are just still limited. But yes, no question, yes.
Sometimes I see letters and numbers as doubles, like a 3 will appear as 33, or the word as will look like ASAS. Also in the night, all lights, such as street lights, have diamond shapes around them and appear as either pink, blue, or green. Is this Parkinson's?
Yes and no. Again, dryness does all those things. So basically, that's one of the most common things we see with people with dry eye. They say 3s or 6s or 9s. If you can't make a high quality tear film, then everything is blurry. The same way, if you can't get moisture to your mouth, the words start to get garbled. Every moist part of the body must stay moist to work. By 3 o'clock in my office, I'm talking all day with a mask on, and my voice is, it's hard to talk. So each one of those things, glare and halo on lights, seeing double, ghosting numbers, those are very common dry eye or meibomian gland dysfunction problems, and Parkinson's makes all those worse. So seeing somebody who specializes in meibomian gland dysfunction will help you a lot.
My vision is worsening my posture. I am very nearsighted. In contact lenses, -10L and -8R. I also have a spinal fusion at C5, 6, and 7. So eyeglasses leave a gap down below exactly where I look to see the stairs. So I prefer the lenses, even though I lose 2 for every 1 I get. I am also farsighted now, so I'm doing a monovision with my lenses. And I know this is an optometrist issue. Retinas are thin, but have been for decades. I have lenses and 8 pairs of prescription glasses for over lenses for distance, for reading, for computers, no lenses for regular distance, computer, sunglasses, and I still am hunching over to try to find a way to see something clearly. I know that this is really optometrist territory, but I'm asking you, is this variation in vision just a PD, visual translation thing? I test out at 20/20 and 2/30. I have small cataracts, but too soon to do anything. Could it be dry eyes? Is this just not getting the right power in each eye? I just keep getting more glasses. Thanks.
Yeah, I mean, again, if you have 8 pair of glasses and contacts and you're never seeing properly, my, dry eye would be a very common problem, a very common underlying problem. It's very hard to get a crisp, clear vision when the eyes are dry. I don't know what contacts you wear. A one-day contact lens is a very excellent option. The same way that fresh clothes feel good and fresh sheets feel good, most people want to wear the same contact for 30 days, but we would never think to wear the same clothes for 30 days or the same underwear for 30 days. When it comes to contacts, you get a 1 day and get a 1 day pair for just the computer and a 1 day pair for just far away. It's okay to change your clothes during the day. I go to work, and I wear scrubs, and I change my clothes. You can wear more than one pair of clothes for the day. So maybe they'll feel that, I have a pair of glasses and one pair of contacts. But you can talk to your doctor about trying a 1 days. Have a 1 day pair that you wear for the computer and a 1 day pair for distance. But yes, if your eyes are dry, having a non-silicon 1 day, many of the lenses are silicon, which are not good for dryness. But a non-silicon 1 day is a ton of moisture. When it comes to reading and posture, it's a question of a working distance, how far away you are. If you can tell your optometrist or your eye doctor the distance you have from you to your screen, that's just math. When it comes to people who are nearsighted, often we make the glasses too strong or contacts too strong. So having an excellent optometrist who can figure out making your contacts not too strong and getting the proper distance, and maybe even trying a 1 day disposable contact. It's not good for the environment, but it's good for you.
Okay, let's see here. What is the dry eye therapy you mentioned? I understand hot compresses and omega-3 vitamins. What is the therapy? Maybe she means the light, the pulse light.
Yeah, so we have several things we do. One thing we do is something called intense pulse light. It's used by dermatologists. The skin gets inflamed, and that's why it's neither a dry nor an eye problem. The same way a milkmaid can churn milk to butter, the inflammation in the eyelids causes the oils to harden up. So we use a dermatologic process called intense pulse light to treat the skin of the eyelids. It reduces redness and puffiness, and then we squeeze out the blocked oils. But there are many similar things that are out there. LipiFlow, iLux, BleFX. You can talk to your doctor about this. It's really been the newest wave of treating dry eye. We do it all day in my office, about 10 times a day. It's really made our patient very happy and been very successful. But if you don't get the blocked oils flowing with some technique, I don't really care which one, it's hard to feel better and see.
I have double vision, but I have also experienced bars that cross the top and bottom of my sight. These bars are generally fuzzy, and they appear most often after I take off my glasses with their prisms. I've chalked them up to my eyes readjusting to prismless sight, but it would be nice to know that the phenomenon is nothing more.
I don't know. That's a really challenging question. When it comes to prism, some people need them and some don't. So I'm sure you need them. If you have them, I'm sure you need them. But I mean, I have seen people that get prism, but their eyes are dry. So it's just, like all problems, when the eye is dry, it's hard to know what you're treating. And when you tell a doctor, I'm seeing double, a knee-jerk reaction is, you must need prism. But when it comes to visual phenomenon, stars, bars, lights, I've heard all kinds of things, snow, visual snow syndrome. On any one visual perception, it's hard to know what it is. Is it harmful? It's no way it's harmful. There's no way it's bad for you. Seeing bars won't hurt your eyes. It's not bad for your eyes. Why you're seeing them, I really don't know. But it's not bad for you.
How can I tell if my dry eye or when my dry eye is under control?
Yeah, when you wake up in the morning, your eyes are not stuck together. When you can read for 30 minutes without eyes burning, If you feel that your eyes are crisp and clear, you can drive at nighttime with that glare and halo. You know, the Supreme Court Justice, Felix Frankfurter, was asked, what's pornography? And he said, I know when I see it. If your eyes feel great, your eyes are under control. If your eyes are burning, blurry, tearing, double vision, it's not under control.
Okay, I think that was, oh, wait, maybe there's one more here. Okay. When looking both ways before crossing the street, I have to slow down the speed with which I turn my head back and forth to be able to see what's coming. Over the last 10 years, the view of both ways of traffic has gotten slowly but steadily less smooth and more fragmented. Is this because of PD?
Again, when it comes to an individual visual phenomenon, I just don't know. And when it comes, again, because the brain is still a black box, you know, how do we, for example, you know, to teach a computer to do a spell check? When I was a kid, I had something called a Commodore 64, and it cost $200. And my grandpa bought it for me. He told me for 20 years how much he spent, $200 for a computer. And to run a spell check, it would run through every word on the screen to check the words. Now they can do them almost instantaneously. But how does the brain work? How does the brain figure out all the words I'm saying now? My brain lines them up. How does the brain, I could do this in French and Spanish and German. How does the brain go from English to French to Spanish to German? I can do in Arabic too. You know, how does the brain do what it's got to do? And we just don't know how the brain puts the words together. Where do we store all the knowledge? I mean, you know, it's hard to tell, but I'm a genius. And so, but where does the brain put all that knowledge that I jammed in there? All the fancy colleges I went to, all the books I read, where does it all go? You know, so we don't know these things. We don't really understand how does the brain, how do we get music and art and literature and poetry? Where does it come from? You know, where do we get the wonders of the human mind? It sounds simple, but we can't make computers do it yet. And you'll hear about, you know, Chat GPT and AI, but the brain still can't, the computers still can't make literature and art. And we don't have a computer Picasso or a William Faulkner that a computer can do. When it comes to these sorts of dysfunctions of visual processing, we don't know how they work.
Next question. I think I know the answer to this one. I am nearsighted, and over the years, my distance vision has gotten worse, and I see halos around headlights. My ophthalmologist says cataract surgery will resolve both of these conditions. Could it be dry eye?
Yes.
Yeah. Okay, next question. Can you recommend an eye drop for someone with Parkinson's and double vision? I have had cataract surgery on both. I think he means eyes.
Again, I mean, so when it comes to that, the drops over the counter work a little. I like one called Oasis Tears. There's a new one called Ivizia, lowercase I, V-I-Z-I-A. It's over the counter, Ivizia. It was in Europe for years. It was called Thelos Duo. It's a combination of an aqueous and meibomian gland replicator. Works great. There's coupons in the penny saver. When it comes to more complex stuff, you got to talk to your eye doctor. There are many things we can do.
Okay, that seems to be the end of the questions. Okay, thank you. Thank you very much, Dr. Levinson. And if anybody, I think, so everybody will be getting an evaluation. Please fill them out and send them back. And thank you all for tuning in, and we'll see you the next time.